Hi, and welcome to the Pink Movement podcast with your host, Christy Collier. Each episode, you'll hear from some awesome people in and around the breast cancer world, sharing their wisdom on all things health and well-being. You'll hear simple information, practical advice, and useful tips to help you stress less, move more, and feel better.
Please note that this podcast contains general information only and should not be treated as medical advice. Hi everyone, Christy Collier here, and thanks for joining me on the Pink Movement podcast. We're now up to episode 18, which is amazing, and so many women have reached out to say how beneficial they found this podcast and the information in it. But in order to keep producing these podcasts, I do need your support. Despite what many people may think, podcasts cost money to produce. There's hosting fees, website fees, equipment, and a whole range of other little bits and pieces that go along with that. So if you want to do your bit to help the Pink Movement podcast reach women all over the world and help them through breast cancer, then it's time to become a patron, which you can do for as little as $5. Head on over to my website, thepinkmovement.com.au, and click on the Show Your Support button. Or go directly to our Patreon page, which is www.patreon.com/The Pink Movement. Now, if becoming a patron is not in reach for you right now, you can help out by spreading the word of the podcast to others with a breast cancer diagnosis. And or heading on over to iTunes and giving us a quick rating and review. Now, on to today's podcast. If you're a regular listener, you'd already know how passionate I am about exercise following a breast cancer diagnosis. It's evidence-based, proven by research, and is the absolute number one most important thing you can do for yourself after a breast cancer diagnosis. And if there's one person in the whole of Australia you want to hear from when it comes to exercise and cancer, it's Professor Prue Cormie. And I have been fortunate enough to have her chat with us on today's podcast. Prue subscribes to the notion that exercise should be viewed as medicine. She even states that if you could encapsulate the benefits of exercise in a pill, it would be the most widely prescribed medication in the world. So what you'll learn from Prue in today's episode is all the latest research findings around cancer and exercise, the many benefits of exercising during treatment, the recommended dose of exercise, so what you should be doing and how you should be doing it, who you should and can work with regarding your exercise, and then a few sneaky tips on rebates about working with an exercise physiologist and how you can minimize your spend in this area to maximize your outcome. This episode is an absolute must listen to help you truly understand why you should be exercising following a breast cancer diagnosis. So settle in and let's get to it.
Associate Professor Prue Cormie is an accredited exercise physiologist whose research and clinical work focuses on the role of exercise in the management of cancer. On top of over 65 publications and book chapters in this space, Prue has produced influential research exploring the effectiveness of targeted exercise prescriptions in counteracting side effects of cancer and cancer treatments. A core component of her work is translating this research into practice to create meaningful improvements in healthcare services for people with cancer. Prue is the inaugural chair of the Clinical Oncology Society of Australia Exercise and Cancer Group and also leads the Exercise and Sports Science Australia Cancer Special Interest Group. She is a passionate science communicator with over 100 invited presentations in the last 5 years, including a TED Talk titled A New Contender in the Fight Against Cancer, where Prue presented a concept of exercise as medicine, which is the exact topic we're here to talk to her about today. Now, if there's one person in Australia to speak to about exercise and cancer, it's Prue. She is an extraordinary woman and a pioneer in this space, and I'm absolutely thrilled to have her join us on the Pink Movement podcast today. So, Prue, welcome, and thank you so much for taking the time out to join us today.
Oh, thanks so very much, Christy, for the very warm welcome. It's lovely to be here and be chatting to the podcast listeners.
Fantastic. Thank you. The pleasure is all ours. I'm so glad you've been able to join us. But Prue, we might start off. Obviously, you are an accredited exercise physiologist, and you could have really gone through and specialised in any sort of area after that. What and why did you get involved in the exercise and cancer space?
Yeah, for me, I've always been really interested and passionate about understanding what exercise can do from how does exercise change our physiology? How does it allow us to do things that athletes can do? And for me, the thing that's kind of always been where I push my time towards and what I'm most passionate about is how we can use exercise to enhance health. And cancer is so prevalent and it affects so many people in such a huge way that for me, it was an area that I was definitely drawn to because of the potential impact that exercise can have to help people with cancer get through their treatments and get back to being as normal as possible, as quick as possible. So I'm really fortunate in the sense that I love what I do, and I think that I have the opportunity with our team and our work and the field that we work in to really impact people's lives directly that are involved with our work, and then also have the potential to change practice worldwide through our research and our advocacy work. And for me, these are the things that really make me excited about getting up each day and coming into work. So it's really about the potential impact that exercise can have on people with breast cancer and people with cancer more widely that motivates me.
Yeah, fantastic. It's so nice that you're so passionate about it. Obviously you are. I mean, you're doing incredible work in the space. How long have you been doing this for now, specifically in the cancer and exercise space?
It's coming up about 10 years now. So I started my work over in Perth, and now I'm based in Melbourne. And I get to talk a lot about what we do, but it's also a great team that works with me in doing this work. So, we've been able to do a lot of work in the last 10 years and contribute to that a broader field of fantastic researchers and clinicians internationally that are really pushing the field forward.
Yeah, great. Now, what about, there was a paper just recently, or it was a little, not too long ago now, that you released, and it was called The Impact of Exercise on Cancer Mortality, Recurrence and Treatment-Related Adverse Effects. Tell us a bit about that and the outcomes of that paper.
Yeah, sure. So, we all know that exercise is good for us, but really this paper was trying to identify just exactly how good exercise is for people with cancer. And the majority of the work really comes out of breast cancer patients. So this was a systematic review of over 100 different research studies that investigated how exercise impacts people with cancer, their prognosis and their well-being. So basically we're doing research on a whole bunch of other research that's been done and trying to really condense the results into a clear, crisp message. So it's really the most comprehensive analysis of all the available scientific data in the field. And the conclusion of this paper, and this was a collaboration between our group here at Australian Catholic University and also a lady called Professor Catherine Schmitz, who's in Pennsylvania over in America, who's an international leader in the field. This research so basically supports the view that exercise is an important adjunct therapy in the management of cancer, meaning that it's a really important element or treatment or department of treatment that supports primary treatment such as chemotherapy, radiotherapy, hormone therapy and surgery. And this view really results from the observation that people with cancer who were involved in greater levels of exercise had a lower relative risk of dying from their cancer, had a lower relative risk of their cancer coming back, and they experienced fewer or less severe treatment-related side effects.
Yeah, gee, I mean, when you hear it like that, it makes you think, why aren't we all doing it? Lower level of dying, lower level of cancer coming back, and reduced impact of side effects. I mean, as somebody who's been through breast cancer myself, I just think it's a no-brainer. I think obviously there's a lot of research around this, as and more coming out, like this paper that you guys have just done, which you're saying is probably the most comprehensive analysis to date. So, the next question is, how do we get that message more broadly out there to everybody who is being impacted by cancer and sharing those messages about why they should be doing this?
Yeah, it's a massive challenge. So, the data, the research data that we have is really strong. And there's more work that we need to do, and certainly we need to continue to grow the field and develop this evidence base. So we need to have more scientific knowledge guiding our clinical practice. But the quality of the research that we have and the level of evidence that we have currently, it certainly supports the view that exercise should be embedded as a standard component of cancer care. So, this challenge is where to next. How do we actually push this forward? And I think there's a lot of ways that we have to do this. One way we are trying to do it is through education of the health professionals involved with treating people with cancer. So we work with Clinical Oncology Society of Australia and the work that we're doing with the Exercise and Cancer Group. We're putting together a position statement which has actually just been approved by the COSA Council and the board. So the organisation it's a peak professional body representing all multidisciplinary health professionals involved with the care of people with cancer. And the position statement that we've put together and has now been approved and will be launched in the coming weeks and months basically calls for three things. First of all, based on the level of evidence, that exercise should be embedded as a part of standard practice in cancer care and to be viewed as an adjunct therapy that helps counteract the adverse effects of cancer and its treatment. So viewing it as a standard component of cancer care is step one. Step two is all members of the multidisciplinary cancer team to promote exercise and recommend people with cancer adhere to exercise guidelines. And we can talk about specifically what they are a little bit later on. And the third component, which I think is so important, is best practice cancer care to include referral to an accredited exercise physiologist or a physiotherapist who has experience in cancer care. And what that does is it facilitates and allows for people who are going through complex treatments and experiencing a lot of different symptoms and side effects that a similar person without breast cancer would be experiencing. It allows them to actually get a program that's specifically tailored for them. So this is one avenue, and I think what this position statement really does is it positions exercise more than, hey, look, exercise is just not good for you, like it's good for everyone else, but exercise plays an important component specifically in counteracting cancer and the adverse side effects of cancer. So it's not just that, in the same, it's not just that exercise, that you should do exercise, that exercise is good for your general health, but we know that exercise is specifically good for people with breast cancer. And we know that, and breast cancer is where we have the strongest data in terms of the ability of exercise to help patients tolerate treatment, to help, receive more treatments, to, the potential of exercise to actually slow the tumours from growing and spreading. The ability of exercise to then help manage really kind of nasty side effects and the side effects that impact everyone. So, physical deconditioning and declines, cancer-related fatigue, psychological distress, mental well-being issues, and general overall quality of life stuff. We've got, good levels of evidence that exercise plays a role in these things. So I think, getting the message out there starts with not only having really good evidence, but then disseminating that evidence and advocating based on that evidence to health professionals as well as to patients. We also need to be talking to everyone with cancer and everybody who is involved with and around carers, family members about the role exercise can play.
So that position statement, who was that released by, Prue?
So it's the Clinical Oncology Society of Australia, and we haven't yet released it. So we're at this stage, we're actually, Breast Cancer Network of Australia will be endorsing the organisation as well, so the position statement as well. So it'll go out through a number of different channels, but it'll be in the next couple of weeks to a month or so. We'll get this out there and we'll have a bit of a launch. So the position statement really is something that allows health professionals to guide their clinical practice, and it's just one element of what we need to do to really get the word out there and get more people involved with exercise.
Yeah, well, that's a really powerful answer to the question of how do we get that out there? How do we let people know that this is what they should be doing? That position statement is a huge step, isn't it, in that direction? Because as you said, that first step of, exercise being embedded in cancer care. The second one, particularly, I'm interested in, which is healthcare professionals to promote exercise and adhere to exercise guidelines, which we will touch on. So, I spoke about last year in a talk I did the year before actually around wouldn't it be great if exercise was being prescribed by our health professionals, by our oncologists or our other professionals that we were working with. I suppose this is a huge step in that direction, that this sort of position statement and getting this message out there.
Absolutely. We advocate for exercise to be viewed as a medicine. If you could encapsulate the effects of exercise in a pill, it would be the most widely prescribed medication in the world. And even if that pill had just a fraction of the positive health benefits that regular exercise provides, it would be given to every single person with cancer as a first-line treatment, regardless of who they are, where they come from, how much money they have. It would be the first-line treatment. So, viewing exercise as a medicine is completely important from a health professional's point of view, because then they start to incorporate that into the consultations. And we know from the research evidence that 80% of people who engage in an exercise program basically said that the referral that they received from their healthcare professional was a huge contributor to why they were actually there in the first place. And we see that anecdotally. We get people turning up to our exercise, our programs, our research, our clinical programs, who have never in a million years thought that they would be in a gym, certainly not when they're going through chemotherapy or they're going through remission. And never exercised before, never seen the inside of an exercise clinic, and are only there because their health professionals, their specialists have said to them, this is a really important component of the management of your breast cancer.
Yes. Yeah, if we could get every health professional doing that, imagine the impact it would have to those women who do have breast cancer, to anyone that has cancer, obviously.
Absolutely. And, as patients, we listen to health professionals. Health professionals convince us, and specialists convince us to get cut up and have surgery. They convince us to, go through chemotherapy for months and months at a time and get our bodies irradiated. Why shouldn't they be able to convince us to exercise? Or why shouldn't we view it, when exercise is presented in the same way of these treatments, it's not as painful, it doesn't cause as many side effects. There's actually good side effects that happen in this. It takes some time, yes, but it costs less than the other medications that you'll be prescribed. So why shouldn't that be viewed as a standard component of care? So
these health professionals are our credible sources of information. I know, when you go through a breast cancer diagnosis, you're bombarded with information. You definitely Dr. Google stuff, which we know is all ridiculous, but we all do it. But we all know that the most trustworthy person or people that we should be listening to are our health professionals, and they are the ones that provide us with that credible information and those high levels of recommendations about what we need to be doing for our cancer diagnosis. So for them to be not necessarily prescribing, but promoting, encouraging exercise, as you say, it's almost like that's the kick in the butt that someone would need to get out there and start doing it.
Oh, completely. When I talk to cancer care specialists, I say, the 3 steps to getting your patient to exercise. The first step is to prescribe exercise. The second step is to refer to an exercise specialist, and the third step is to do regular checkups. Because what that does is that, every time you're coming back in and seeing your specialist, that they're going to ask you about your exercise, and how many times can you keep saying, oh no, I haven't done anything, or no, I'm not, when they're saying this is really important, this is going to help you manage your treatments, this will just help tolerate your treatments. I can give you more chemotherapy if you're more robustly developed. And the way to do that is to exercise, first of all, exercise, eat well, sleep well, those types of things. So absolutely, and there's a lot of barriers, is right. There's a lot of things that as a patient that you say, there's one more thing I have to do on top of everything else. But this one more thing is something that you own, that you control, that engages you in the fight against your cancer, or that allows you to take control over the side effects that you may be experiencing. And it's also something that I think not only impacts your cancer, but it impacts your well-being more broadly. So there's, with every barrier that pops up, there are also a lot of really good reasons why exercise should be prioritised.
Yeah, and I think you mentioned there about the checking in. That really provides that accountability. Like you say, there's only so many times you can rock up and say, no, I haven't done it, no, I haven't done it. But on the flip side, and you touched on it as well, in the fight against cancer, as an individual, as a person, it's great that we put our hands we put our health in the hands of professionals, and we absolutely trust them that they will do everything they can for us. But it is so important that we do what we can for ourselves as well. And that one of the very few things that you can do after a breast cancer diagnosis is this focus on your health and well-being, and exercise being part of that. So from a personal perspective, I felt very out of control when I was diagnosed, and I just didn't have much input into what was happening in my life and all the treatments and so on. But the one thing I did have control over was my health and well-being, and the exercise was a huge part of that. So I really made it a priority to keep focusing on that, because that was the one thing I could do to give myself a better chance of, a better chance of reducing recurrence, a better chance of not dying from the breast cancer. And certainly I know myself from a personal perspective how much being active and exercising during treatment had a huge impact on the side effects. My side effects were just nowhere near what others were experiencing, and I know everybody is different. I completely appreciate that, but I think you sort of know yourself. I 100% know that it was down to me continuing to exercise on a daily basis. And, sometimes it literally was a 10-minute walk around the block with the dog, because that is all I could handle. But other times I was able to do so much more. I just did what I could do every single day. And I can't, and this is why I'm so passionate about it, and you can probably hear, but I can't speak highly enough of it, having sort of gone through it and seeing firsthand how this all works.
Absolutely. And Christy, your experience is something that is reflected in the research literature. It happens to thousands of patients that we research, and we get engaged in these scientific investigations. We know that people with breast cancer who are exercising well during chemotherapy actually have less chemo dose modifications. They can tolerate higher doses of chemotherapy. Their strength and their fitness remains at a higher level. They feel less cancer-related fatigue and have higher energy levels. Changes in body composition aren't as much. The impact on psychological stress and mood and stress management isn't as much. So, there's a whole range of factors and sleep quality is another kind of example. The potential also, we're seeing very early research to suggest that exercise may play a role in minimising the impact of cognitive impairment, so chemo brain or chemo fog, and potentially even peripheral neuropathies as well, where you're having hands, tingle, issues with pins and needles and tingly pain in your hands and your feet. So these things we know from the research literature are backing up your personal experience, and it's certainly what we see with many of the patients that we work with as well.
Yeah, God, I love it. You mentioned about a little while back, just about when you are encouraging health professionals to promote exercise, that they would have to adhere to exercise guidelines. What are those guidelines that you mentioned?
Yeah, so the evidence-based guidelines are that all people with cancer should avoid inactivity and return to normal daily activities as soon as possible following a diagnosis. basically what that means is to be as physically active as your current abilities and conditions allow. So that's much like you said, on the days that you can handle a 10-minute walk, then a 10-minute walk is great. If there's days where it's getting up and going to the mailbox and back is all you can handle, doing that is really important. This is a big shift because clinical practice guidelines, 20 years ago were that people with cancer should rest. They should avoid activity. It's completely turning that advice on the head, and I think this is a big challenge that we need to overcome, not just from health professionals' point of view, but also from patients' point of view, and also then from your family members and carers. So because people want to kind of wrap you up in cotton wool and keep you protected and keep you well, and it's hard to see someone being so ill and try and encourage them to go and be active. But this is exactly what the evidence is saying. And then we get into some specifics about when actually providing a significant health benefit. So the data around the benefits that I was talking about before in terms of handling, able to tolerate higher treatments, able to counteract the impairments in physical function or cancer-related fatigue and so on. This comes out of an exercise prescription which involves aerobic exercise, which is things like walking, jogging, cycling, swimming, and that's 150 minutes of moderate intensity aerobic exercise each week. Now, it sounds a little bit funny, and I'll explain that in a minute, but in addition to that, it's 2 to 3 resistance exercise sessions. And that's involving moderate to vigorous intensity exercises targeting major muscle groups. And this is really lifting weights. So typically what you see is people in the gym lifting weights. So let me go back to the aerobic exercise for a second. So 150 minutes moderate intensity aerobic exercise. It's a weird number, but when you break it down, it's a 30-minute brisk walk on 5 days a week.
Yeah.
The resistance exercise, it's lifting weights involving major muscle groups. So this can be weight-bearing activities, but you really need to be providing an overloaded stimulus to your muscles. So more than what you would normally do when you're walking, for example. So lifting weights at a moderate intensity is key to actually eliciting physiological changes within your body that prompts these beneficial effects that we see. So the combination of the two is really important. Because they're two different types of exercise. And the different types of exercise primarily target different body systems. So when you look at the aerobic exercise, it primarily targets your heart and your blood vessels and the ability to get oxygen all over the body. So that really targets positive structure and function of those systems. And then the resistance exercise really targets improved structure and function of the muscle system, your bones, and also your neural system as well. So the type of exercise is really important, that those two are combined to maximise those benefits. But really important, and something that's so often overlooked when people talk about exercise, is the quality of the exercise. And the quality of the exercise comes primarily through the intensity of that exercise. So I said moderate intensity, for at least moderate intensity for both of those things. Now, that's really important because our bodies need new stimulus and they need to be overloaded to adapt, to improve, to enhance our body systems and then to realise these health benefits. So the moderate intensity becomes key to actually getting the most benefits. So when it's walking, it's not, imagine you're running late for a very important meeting and you're briskly walking to get to that meeting. That's the pace that you need to be walking at. So your heart rate needs to be increased. You need to be puffing. You need to be sweating. If you think about going for a walk with your dog, you're being pulled by a big German Shepherd as opposed to pulling along a little Chihuahua or something like that. So that's key. The resistance exercise as well needs to be at least a moderate intensity. So if you're using an exercise machine, you shouldn't be able to, just pump away with a whole lot of repetitions on that exercise and have a conversation with the person sitting next to you. It needs to be hard enough that you can really do maybe 8, 10, 12 repetitions, but not too many more after that.
Sure. So I think with those two types of exercise, as you say, this is what you really need to be doing to engage the benefits that you've mentioned. The aerobic side of things for the average woman with a breast cancer diagnosis is certainly something that they could just get out there and do themselves. At the very least, a 30-minute brisk walk 5 days a week. The resistance side of things obviously would be a little bit more difficult and probably would need to involve going to a gym or going to see somebody. So for many women who either haven't involved in exercise or certainly haven't involved in any sort of strength or resistance training, where do they go for that? What's your advice for that sort of thing?
Absolutely. So let me just say, first of all, that, these numbers are really lofty numbers. And for some of you guys out there, you think, how on earth could I possibly do that? There's weeks where I can't get close to this, depending on what's going on, So these levels are really, they're lofty. They're an aim to work towards. And I just keep in mind that any activity that you do is better than none, and generally speaking, more is better than less. So on the days where you're feeling absolutely horrendous and you can't possibly even fathom, a 30-minute walk or a 15-minute walk, even if you can just get up and be active around your house as much as possible, that's fabulous. So keep in mind that that's the end goal, and anything that you do towards that is positive. Now, when you're actually trying to get the best out of your exercise program, these recommendations need to be tailored to your individual abilities, and that's specific to the fact that there's changes or modifications to these guidelines that need to be applied to you. What stage of cancer do you have? What kind of treatments are you going through? What symptoms and side effects are you experiencing? And what's your general health status? Do you have back issues and so on? So this is when, for someone, especially when you're doing resistance exercise, the referral to an accredited exercise physiologist is your best bet to start off with. So an exercise physiologist is an allied health professional who's recognised through Medicare as the most appropriate health professional to deliver ongoing exercise to people with chronic diseases. So EPs, they go through 4 years of university and they go through continuing professional development. So as an exercise physiologist, I use exercise as a medicine in order to help in counteract the side effects of disease to improve well-being. So in much the same way that a doctor will prescribe a specific type of pill or therapy, an exercise physiologist will prescribe a specific type of exercise based on a change within the body that's required to be elicited to counteract something that's going on with your breast cancer. And that prescription is based on a specific type of exercise at a precise intensity and a volume, and that's based on a mechanism of action or a physiological change and a dosage required to make a specific modification to your health. So it's like, a doctor wouldn't give you an antihistamine to treat your cancer, right? They'd prescribe you chemotherapy or radiotherapy or surgery. So in the same way that an exercise physiologist wouldn't give you a generic program for a young, fit 18-year-old, they develop a program specific to you.
Sure.
Specific to your breast cancer. So they're the best people to see in terms of maximising your safety and the efficacy of your exercise program. And there's a lot of other health professionals out there that are great at talking about exercise and delivering exercise, and they could be individuals at your local gym. It could be a physiotherapist who's really keen about delivering long-term exercise. So it's really about finding someone who has experience in people with cancer. So I can give you some links as well of some of the key areas to look for accredited exercise physiologists close to your home and potential programs and things like that.
Yeah, that'd be great. I mean, it's a search function on the ESSA website, I think, is it?
Yeah. If you go to www.essa.org.au, there's a little button that you can click on that says Find an ACP near you. You click on that and pop in your postcode, and then it comes up with a range of exercise physiologists. And we do some upskilling as well. So exercise physiologists, they work with anybody with chronic disease. And if they specialise in cancer, then you know you're getting even better delivery of exercise prescription for those guys. The other thing I just want to touch on as well that you mentioned is, you don't have to continue to go and see an exercise physiologist and go into a specific program ongoing. All you're doing is having a chat with a specialist. So it could be one conversation that they can talk about delivering a strategy for your exercise that suits you and your requirements. If you're juggling work, young children, and you think there's no way I can get to the gym, they can develop a home-based program that works around the barriers that you're experiencing and gives you the information and the resources that you need to then do that effectively and safely. So it's all about tailoring a program that's specific to you, and that includes the delivery of that program as well, when you do it, how you do it, what you do.
Yeah, I think that's a really good point, Prue, because I know certainly going through breast cancer for a lot of women, fabulous idea to connect with an accredited exercise physiologist, absolutely. Cost would be a factor at some point in time. So obviously during cancer diagnosis, a lot of women aren't able to work. So a fantastic suggestion that it can just be a consultation with a strategy and program for how you engage. So it doesn't have to be, although it can be if you want to, an ongoing one-on-one sort of program, but it could just be a consult and a strategy and program for you to move forward with your exercise. And I think that's a really valid point for a lot of our women who are listening.
And I think the first thing that a lot of people say is, isn't this expensive? And isn't exercise expensive to do? And we know, so through the chronic disease management plan, which is a GP referral to an exercise physiologist, you can get rebates for up to 5 individual sessions. So an out-of-pocket cost could be nothing up to maybe $30 depending on who you're going to see. So you could actually pay nothing to have that expert advice. There are group services that are available as well, so they may range from $10 to $20. As well as an individual sessions that will probably be higher depending on who you're seeing. In saying that, it's not only Medicare that provides subsidies. There's over 30 private health insurers that now provide subsidies for accredited exercise physiologists, and that's both as a one-on-one consultation as well as group-based services. So yes, exercise is an additional expense on top of everything else that you have to pay for when you're going through breast cancer, and of course on top of missing out on a lot of the income that you would otherwise be generating. So it is another expense, and for a lot of people it's hard to find that money. But I would challenge you to think about this as probably a really smart investment and a cost that comes with additional health benefits. First of all, to your overall well-being, to help enhance the management of any other chronic diseases you may be experiencing. And we know from the research literature that exercise and getting involved in exercise can be a stimulus for other health-enhancing behaviours. So it might help you then find the motivation to eat a bit better, to sleep well, to drink less, to quit smoking, those types of things. So it really, when you think about exercise and generally speaking and the impact that exercise can have on health and well-being overall, it's probably the smartest health insurance policy you could ever buy.
You can't put a price on your health either. I think that's an important thing. And, as you say, all the benefits of it, and certainly even post-breast cancer, decreasing that level of recurrence, it's just so important. And I know, it's sort of, as we say, I think it's just something we need to find the money for, because the benefits just far outweigh anything that we could receive anywhere else. And I think, touching on our topic today was exercise as medicine, and we've spoken about that throughout. I think it's probably not exercise as medicine, but it is exercise is medicine. And for all of the reasons that you've mentioned here in the podcast today, and it's just, I'm so glad that we've got to hear from you all of these elements around the research and what the research is stating, and the information that's now going out to health professionals, how exercise is going to be promoted out there to women with breast cancer, and really how they can do it, why they should do it. There's just so much out there, and I mean, we could talk forever about it, obviously. So I suppose, Prue, I just wanted to wrap it up and just say thank you for basically taking the time today and sharing all that information with us. I know it will be of great benefit to all the women out there who are listening to this podcast. And look, I'm so pleased with all the work that you're doing, and please continue sharing that with us, and maybe we can have another chat with you later on down the track when there's some new information and some more research around this that we can share with our listeners.
Absolutely, it'd be my pleasure.
Great. Well, thank you, Prue, for taking the time. It's been a pleasure.
Thanks, Christy.
Thanks for listening to the Pink Movement podcast. For episode notes, links and downloads, head to thepinkmovement.com.au. Like what you're hearing? Join our Facebook page, subscribe through iTunes, and while you're there, provide a quick review. Want to help out? You can support the ongoing production of this podcast by becoming a patron. Find all the details on the website. The Pink Movement Podcast, helping you to stress less, move more, and feel better.